So what are the examples of second generation or atypical antipsychotic? Clozapine, olanzapine, ziprasidone, risperidone, aripiprazole, amisulpride, and quetiapine. Okay, remember, first generation drug, mostly they have neurological side effect. Neurological side effect like extrapyramidal symptom. But second generation, mostly it is having metabolic side effect like weight gain, hyperglycemia, dyslipidemia, sedation, cyalorrhea, right? So can you tell me, out of these six atypical antipsychotic, which is having maximum weight gain? Last time they have asked this question. Maximum weight gain is seen with clozapine, then olanzapine. Okay, then olanzapine. Minimum weight gain is with ziprasidone and aripiprazole. Minimum weight gain or weight neutral. Remaining all drugs have moderate weight gain. So can you tell me what are the other grave side effects of clozapine? Very, very important. See, clozapine, can you tell me what are other, see the grave side effects? Agranulocytosis means destruction of WBC and neutrophils, myocarditis, and then seizure. Okay, after how much level of WBC, you should stop using clozapine? When WBC is less than 3,500 or less than 3,500. Okay, and when neutrophils are less than 1,500, please stop clozapine. If examiner is going to ask you one question, clozapine and carbamazepine can be combined together or not? What is your answer? It should not be combined together. Why? Because even in carbamazepine also there is side effect of granulocytosis. So remember here, clozapine and carbamazepine should not be combined together. Should not be combined together. Okay. Out of these, where you are going to see QT prolongation, obviously quetiapine, right? Okay. See, remember here, related to EPS, they are asking the question. Dystonia means what? Sudden muscle contraction. So how to manage this? We can give either anticholinergic drug or antihistaminic drug, right? Which one? Any example? Yes, please write down.